Okay, so my name is Kayla Homer, and I'm going to be talking to you about hemorrhoids today. So, what are they? Hemorrhoids are varicosities, which are dilated veins that may occur outside the anal sphincter or inside of it. The ones on the outside are external hemorrhoids, and the ones on the inside are called internal hemorrhoids. As you can see in the picture right here, it just shows you what they look like. Are hemorrhoids common? Yes. From the ages of 20 to 50 years, they are the most one of the most common health problems of that age group. And they are commonly caused from constipation, pregnancy, prolonged sitting or standing, diarrhea, congestive heart failure, and portal hypertension. So what happens when you have them? Some common symptoms would be prolapse, and that is the protrusion outside the anal sphincter. They're going to have some bleeding, and they are going to occur whenever you are going to the bathroom and having a bowel movement. Some signs and symptoms of hemorrhoids would be subjective data, complaints of constipation, so they're just going to be constipated a lot. They're going to have some itching down there. They're going to be in some pain when those dilated veins become thrombosed, and that's when a blood clot forms inside the hemorrhoidal vein. They are also going to have bleeding from the rectum that is not mixed with the feces. Some objective data is obviously you're going to be able to observe and visualize those external hemorrhoids, and you will be able to palpate the internal hemorrhoids. Some diagnostic testing would be for the internal hemorrhoids. They can be diagnosed with digital examination, an anoscopy, and a sigmoidoscopy. The external hemorrhoids can be diagnosed, obviously, by seeing them, visualizing them, and with a digital examination. Some medical management therapy is directed toward the cause and the patient's symptoms. They're going to need to be on a high fiber diet, and they're going to need to increase their fluid intake. And that's just going to help prevent the constipation that they may have, which will help them not strain when they're going to the bathroom, and that can help with prevention of the hemorrhoids. They are going to be on bulk stool softeners sometimes, as well as bran and natural food fibers to relieve that straining. Topical cream with hydrocortisone can help relieve some of that itching and some of that inflammation that can happen down there. The analgesic ointments can help relieve that pain that they may have. Sitz baths can also be given, and that can help reduce the edema and some of that pain, and it'll help promote some of that, promote healing down there. They can also do a rubber band ligation, and that is apparently popular and fairly easy. You can see it on figure 5.17 in the adult health book. And that is where they just put a tight band around the hemorrhoid, and they use a special instrument. And what it's just going to do is constrict that blood flow, and that way it can't keep going, and it'll cause necrosis eventually. And within about 1 week, it should slough off, and there should be some minimal discomfort there. There can also be sclerotherapy done, and that is just where a sclerosing agent is injected into the apex on the hemorrhoid column. Cryotherapy can also be done, and that's just by freezing it. Infrared photocoagulation, which is the destruction of tissue by creation of a small burn. Laser excision, and if the hemorrhoids are bad enough, they're going to have multiple thrombosed hemorrhoids down there, and that is whenever they can do surgery and have a hemorrhoidectomy. And so obviously those are going to be reserved for the patients that have a lot of, those more serious issues. So some nursing interventions. So you want to be direct with your patient whenever you're talking to them about this condition. And you want to be concerned, but they need to take it seriously. So you want to ease their embarrassment, because this is something that some people might get embarrassed about. And you just want them to know that it is serious, but just in a way that you're not going to really embarrass them, and just get your point across about the condition that they have. You're going to want to ask them what they know about their condition and what they have been told already about it, and then ask them what treatments they have already had done. That way you can just get everything about their condition and what they know and everything, and then you can just further, what they don't know, and tell them. You're going to want to observe the patient with a prolapsed hemorrhoid for edema, thrombosis, and ischemia. If the patient has had surgery, you're going to want to make sure to take their vital signs frequently for the first 24 hours to rule out that internal bleeding that could potentially happen because they have had surgery. You're going to want to have them get up and walk as early as possible if they've had surgery, and that can, that along with a soft diet can help facilitate with their bowel elimination. You're going to want to give them sitz baths several times a day. You can also give them an analgesic if it's prescribed before bowel movements, and that can just help with some of that discomfort and pain that they might have down there. A stool softener such as Docusate is normally ordered within the first few preoperative days, just to help soften those stools. And some patient education. You're going to want to explain to them how a low bulk diet can produce chronic constipation. And so they're going to need a high residue diet with a lot of fiber. So the fiber breads and cereal, anything, whole grain, whole wheat products, brown rice instead of white rice, and pretty much any other grain products. And you can also include dry fruits in that, because those are really good to help, with the movement down there of your bowels, and that way you don't get too constipated. You're going to want to educate them not to sit down for long periods of time, and they're going to need to get up and move as much as possible. That also helps with getting everything moving down there. They're going to want to drink 8 to 10 glasses of fluids a day, preferably water, but some people don't like water, so any fluids really. And that, again, just is going to help soften everything. That way they don't strain. They're going to need to exercise, at least some moderate exercise. So especially if they're an elderly patient with this problem, you're just going to want to tell them, get up and, walk around their living room, or if they're in a nursing home, just get up and walk around their room, or just try to move as much as they can. That way they're not just sitting there all day. And you can tell them to try to get into a routine for their bowel movements. I know a lot of elderly, they're always concerned about, they haven't went to the bathroom. So a lot of young people aren't really concerned about that. But if they get on a routine and they have, their bowel movements in the morning or at night, or if they go multiple times a day, just try to get that on the same time frame each day. That way it can help. And you're going to want to instruct them to report any signs of infection or delayed healing. So if they have had surgery, you're just going to want to educate them on those signs and symptoms of infection, and if where they've had that surgery, if it's not healing properly. So, report a fever or anything. If they just start feeling cruddy, they could be getting an infection. If they see anything nasty down there, if they've obviously had surgery, just have them report that to their doctor, as soon as they see that. And the prognosis of hemorrhoids. It's really good. There are several methods of treatment for this. They can do surgery, the bands. So the prognosis of hemorrhoids is really good. So, and that is it on hemorrhoids.